Welcome to the Author's Corner. I'm Ethan Yang. Occupational licensing is a policy and legal framework that affects almost all of economic life, and in certain cases may affect whether or not individuals can participate in the economy at all. And yet, it's a seldom discussed topic. Today on this episode, we have AIER visiting fellow as well as a PhD candidate at Middle Tennessee State, Pratik Nandi, who's going to tell us all about his research on this very important topic. It's great to have you.
Thank you for having me.
So just to start off, can you explain to us what is occupational licensing and why did you decide to study it?
So to begin with, occupational licensing is nothing but a requirement from the government to work. This has grown exponentially over the years. So in 1950, only 1 out of 20 people required some kind of licensing requirement in order to work. That number has staggered right now. 1 out of 3 people, that is almost 30% of the country, requires some kind of licensing requirement, or you can say it's actually a permission from the government in order to work. Now, what it does, it raises the cost substantially and disproportionately for a section of people in order to get into jobs. And it also raises the cost on the goods and services, which are ultimately passed on to the consumers. So most of the times, the consumer not even aware of why they're paying such a high price for the goods. There has been a lot of rules, there's been a lot of things that has been forwarded from the regulators and the government why the licensing is required, and mostly in the pretext of consumer safety. But evidence suggests otherwise. There has been widespread literature that suggests that if there was no such requirement, it wouldn't have been such different. The quality wouldn't have been such different from the time where now there are such stringent requirement put on certain occupation. So there are around 800 occupations right now that are licensed in 150 states, and there are 1,000 occupations that are licensed in or regulated in somewhere. To give you a historical perspective, in the first 2 decades of the 20th century, there were only 23 occupations that were regulated. That number went on to reach staggering 300 by 1970s, and right now we are at 800.
Wow, yeah. That's crazy. So just to reiterate, occupational licensing is almost like a permission slip from the government that
That's
says,
right, yeah.
and
It's just not that as easy as it sounds, that you just need a requirement from this government. That requirement, in order to start working, that can take up to a process of 6 years for you to start working, because there are so much of hurdles that are put forward in order to get into jobs. There is this educational requirement. At times, when you look at the kind of work they are doing and the educational requirement that are being put on those workers makes no sense. Then there are exams and fees, which requires high amount of cost goes with it. And you have to also consider the amount of training sometimes that is required in order to get into those jobs. And the funny part is about occupational licensing in the country is that you choose an occupation and you will see that the requirement of getting the license is very different in state to state. And even some states, they don't even license those occupations. So consider for something like interior designer, right? Which is one of the most harmless occupation that you can take, that even if somebody actually do something bad, that's going to harm the consumers. Only 6 states require them to practice with a license. So the question is, what's happening to those other states? What's happening to those consumers who are hiring interior designers to work for them? So the standard is very different. The requirements are very different. Some states requires even 3 days. To give you another example, shampooers require stringent amount of educational requirement and training in order to get their license. And the license is actually certified by the cosmetologist. Now, the funny thing is they don't learn anything about shampooing while going to that school, but still they have to go through that process in order to get the license, right? It's something. So I got into this because of my advisor, Dr. Daniel Smith. What he did, he specializes in occupational licensing apart from many other specialization. So he looked at Alabama and he looked at Mississippi and he looked at all those occupations that are licensed in those two states. These are two separate papers, I must say. And he found out the cost that the state has to bear because of the licensing regulations that are imposed on those workers. And he also found that the number of jobs that could have been added up if the burden were eased a little bit. Then he moved to Tennessee and he started doing the same thing for the state of Tennessee in partnership with the Beacon Center. And that's when he asked me to come on board and help him with some data collection. And then I just got drawn into it because this is 2021. I mean, the role of the government is to facilitate so that the people can actually work what they want to work, right? It's not to create barriers so that people cannot get into it.
So you actually co-authored a study on a paper talking about the optometry profession and scope of practice. So can you explain some of those findings for us?
Sure. So scope of practice is the boundary that has been set that what you can practice and what you cannot practice. Given the healthcare crisis or the shortage of physicians, there has been relevant literature by academicians who have been pushing this to policymakers that scope of practice should be expanded. Because if you look at ophthalmologists who are like on the top of the eye care, the optometricians do a pretty similar kind of job as the ophthalmologist. Their skills pretty much complement that of the ophthalmologist. There is certain difference in educational requirement which sets out the two, but they were just confined to diagnosis, not treatment. They can just, so that was gradually expanded by the states 1970 onwards in two phases. And what they did is that they gave the authority to so that they can start prescribing and treating. So from being an eye doctor, they became an eye provider. So what we did, so we look at all those states that have expanded the prescription authority to optometrists, but they did it in phase wise. So we took all those phases and we looked at those states where there have been an expansion in scope of practice to the other states where there has not been a scope of practice. And we looked at and found that the hourly wage has gone up. Hourly wage rate has gone up. We also did a triple difference where we put all other healthcare professionals in the control state and looked at particularly optometricians where the states have expanded prescription authority, and we found significant changes as well. So this is something that the healthcare industry where there has been a shortage. We are facing some kinds of shortage of primary physicians and specialist doctors, and this should be the way the policymakers should look at it. It's like to ease the burden of those specialists and bring in more supply of healthcare professionals to take care of the growing demand. So that was pretty interesting because there has been no such work in scope of practice, particularly looking at the eye care. There has been dental hygienists and dentists and looked at how expanding scope of practice has increased welfare, just not for the people of the state, but have raised earnings for dental hygienists. So we did the same with the optometricians.
And you have another paper which touches on how occupational licensing particularly disadvantages people from certain backgrounds, like former prisoners, racial minorities, poor people. And when we talk about occupational licensing, I looked up a little bit and did a little bit of research, and some of it might make sense, like brain surgeons or something like that. But there's also, you need a license these days to paint walls, trim hedges, do hair. That's a huge one, actually. So can you explain to us how these basically prohibitions on who can and who cannot work, how does this fall mostly on the shoulders of vulnerable people?
So who decides it? The government decides it. And why does government decides it? Because there is a set of group of regulators that are actually pandering to the government, making sure that the barriers are kept high so that people cannot enter the job, again, in the pretext of consumer safety. So there are educational requirements, as I said to you, and some of the educational requirements say that you need to get a high school degree. Now we can look at races and we can see that there are there are literature that blacks in certain areas have higher high school graduation rate than other race categories. So essentially what you're doing, you're keeping those people out from getting into certain occupations because they don't have their high school degree. And again, the whole point is, as you mentioned, Ethan, that we are not talking about occupations where there is actually a threat to consumer safety. We are not talking about pilots. We are not talking about brain surgeons. So this is what Institute of Justice did in 2012. They looked at the 50 states and DC and looked at the identified 102 low occupying job occupations. And they surveyed that and looked at it, which of the states regulate it, which of the states don't regulate it. So essentially it disproportionately affects people of color, as you can say, because it bogs them down because of the educational requirement. It disproportionately affects military spouses. Just think, like military spouses are constantly on the move. Somebody, if a spouse is manicurist, if she's moving from one state to another, she has to go through a whole set of requirements again in order to do the same kind of job which she's been doing in another state. That doesn't make sense, right? Um, so I think that consumer awareness is something that needs to be grown. People needs to talk about it more, uh, and people should held responsible for to their state legislators and congressmen, uh, because at the end of the day, if the justification is a better product, consumer safety, it could have been understood. But research shows otherwise, right? Research shows that it disproportionately hurts certain section of people who needs, who doesn't needs the government assistance in order to get on their feet and earn a living. But somehow there is these barriers that are being imposed on them, artificially keeping them out of the job. You talk about other categories as ex-convicts, right? So there are a lot of people who want to rehabilitate themselves and get back into occupation, but there is a clause which says good moral standing, right? Which actually bars all the people who have done any kind of jail time, preventing them to get into occupation. And there has been research, there has been literature which looked at states with stringent occupation licensing requirement and looked at how the recidivism of the crime rate, it's pretty higher than the state with the less stringent, like relaxed occupational regulations. So these things adds up. These things adds up and hurts those who gets hurt the most by these rules. And this is one of the institutions that have grown over the period of time, and it's just getting bigger and bigger. This is a bipartisan thing. This has nothing to do with political affiliations. This is something that is, so also one of the reasons why I'm pretty drawn to this research, because you can see the results instantly. Like if you actually do the research and present it to the state legislators and say them to remove those barriers, very soon you can see the growth in the state, because more and more people would be trying to get into those jobs, right? So that would be good for the state GDP. So yeah, this is something which requires more attention, which requires more intellectual discourse, and which needs to go at one point of time.
And when you look at the sort of professions that are that have these licensing requirements, you see things that are very similar, like hair trimming, hair cutting, florists, flower arranging, painting. Do you think that maybe some legislators thought this would be good for public safety, but perhaps even the entrenched economic interests that already existed, like the people who already own the florist shops and all that kind of stuff, just trying to keep out competition? Do you think that has something to do with these restrictions?
Oh, absolutely. That is the core of it, because you have to see the board that comprises of the licensing board of any particular occupation comprises of the people of that occupation only, right? So if you're looking at the licensing board who are regulating florists in a particular state, they are florists themselves, right? That's why they are on the board. So they don't want competition, right? They don't want people to come and enter in the market, because economics suggests as more people enters in the market, the price goes down, and that actually improves the quality of the goods, which is being suggested here otherwise, right? So you're right. So the people who are actually keeping people out of the job, they are already in the profession. That's why they don't want others to get into their job occupation, so that they can keep the price high of the goods and services.
And so you have another paper actually that explores the role of direct democracy particularly using public referendums to combat these rules. Because otherwise, I feel like no one would really. This is not an issue that someone wants to die on a hill for, right?
Right.
So can you explain what are the findings of that paper?
So that's actually a white paper, like more of a policy implication suggestion for the state of California. Now, California is one state that actually practices direct democracy a lot compared to other states in the country. Even if you look at the last election, there were at least 12 statewide ballots that were put from criminal justice reform to rent control. So this paper was in the context of something called nurse compact licensing. So there are 34 states in the United States which allows nurses to travel within those states. And you can practice nursing if you have licensing from any one of the states, which ideally is the way forward, right? If you have a license being issued by one particular state, you can be held responsible if you do something leading to consumer harm in other states. California actually, so there was the Senate bill that was killed in California, right? And it was killed with the help of California Nursing Association, the regulatory board that controls the nurses who gets in and who gets out in California. So my suggestion is, like, if the policymakers are not listening, the consumer, the people who have the option to take an issue onto the ballot, they should take it to the ballot and leave it to the state to decide. Because California is facing a huge amount of healthcare worker shortage. They have eased some regulation due to COVID, but those are temporary. They will go away once the COVID restrictions goes away. But what is the what is the thing to move forward? Maybe if the Californians think that this is something that is going to benefit them in the long term, they can put it to the ballot and let the people of the Californians decide whether they want California to be part of the NAS licensing compact state or not.
And hopefully that idea does get some traction.
Hopefully.
So to wrap up, you've already pretty much answered this question, but I guess we can reiterate.
Sure.
On net, what do you think of this whole regime of occupational licensing? Are we safer because of it, or are we, like you say, just we're just paying more for lesser quality products? And with that in mind, what are some reforms that you would want? And then on top of that, what reforms do you think are realistic?
I think all reforms are realistic, to be honest with you, Ethan, because the academics who are working on it, they are not suggesting anything that is not unrealistic. So there are a couple of ways to approach it, right? First, you can actually uniform it. If you can uniform the licensing regulations across the states. At least if you don't want to do it across the states, you can do it region-wise. So you can do it East, West, Midwest, and South. These are 4 different regions by which we can club states in our country. And we can, to begin with, make sure that there is perfect mobility between the workers in those particular regions. So you can get a license, like a compact license for, say, florist or, say, shampooer, who can practice all the states in the South. He or she doesn't need to ask for new licensing requirement every time moving the state line. And this is something that actually got us in the Tennessee paper, because if you look at the state of Tennessee, it borders with 7 states, right? Think about all those counties that are on the border state line, right? So you are absolutely restricting their mobility when the licensing requirements are very different when they cross the state line. Sunset review boards, where each, in a periodical time, you look at the licensing rules and start easing them out. You identify those occupations which pose no threat to consumer safety, and there are alternative ways, there are certificates, there are costless ways of making sure that there is some sort of oversight. But again, you're making possible for more people to enter the workforce. And also, like, as a society, we will always want to give second chance to people who have done some kind of mistake and have faced jail time, because that leads to the prosperity of all of us, right? You don't want to shun them and keep them out. So maybe starting to ease out the restricting rules for ex-convicts, making easier for military spouses to keep working. Arizona, for example, uh, took a right step, but it's not the perfect step, but in a right step, where they said that if somebody is moving into the state, they can start working immediately, but over the due process of time, you have to get the license from Arizona. But still, it's better. At least you are not a lame duck for 4 or 5 months trying to get the licensing requirement to start working. And more research. I think there are, so I have been working with the NEE Institute, the NEE Center, which is in St. Francis University in Pennsylvania, where they just work with occupational licensing. Then there is ACRE, which is in University of Central Arkansas. They also work with state licensing and rules. I think my 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 observation, this has to taken from the state level. The federal, it cannot be approached from a federal point of view. The state starts need to easing out licensing regulations, start needs to identify occupations which are not perceived to consumer safety or threat, and start easing them out, and try to come some sort of uniformity with other surrounding states at the requirement to get a certain license for an occupation.
Well, Protik, thank you for this very enlightening and insightful conversation. I certainly hope you get your way with this as well. Please be sure to follow AIER on all our various channels like Facebook, Twitter, YouTube, as well as visit our website at aier.org. If you really liked what you heard and you would like to support more cutting-edge research such as this, please consider becoming a donor for AIER. All of this information and more can be found on our website at aier.org. To our listeners, this has been the Author's Corner. Thank you.